My name is Eileen Halbert. I'm the Executive Director here at 2Life, and I want to welcome every single one who is jumping onto the call, and the numbers are climbing. This is the fourth in the series of our Women's Health Conference program for this year. And in a year that has given us all sorts of challenges, it's been wonderful to share the information that we have. What I have noticed is that many of the people who are joining on with us today have participated in some or most of the other programs that we've offered. And as with the programs that we had in the November and December time period, we'll make these programs available, at least for a limited time, on accessible via the video web through our YouTube page. And so I encourage you, if there's some material there you want to see again, you'll be able to do so. And we'll send links out following the program. I've also mentioned that we will have a Q&A period after this. And I really think of that as, some of the tying of the concepts together. And this group never, ever fails, but to ask really wonderful and insightful questions. And so I will invite all of you to put questions into the Q&A, if you can get on that link at the bottom of your screen or in the chat box, whichever is most convenient to you. I will be monitoring that area, and we'll pose the questions to Dr. Bao when we're at that time. The field of medicine really continues to evolve in so many ways, and I don't think can say that there have been more changes than in the area of integrative medicine. And so we're really delighted to bring you, I think, a person that is extremely well-versed in the area of integrative medicine, has really developed the concepts and a practice around integrative health that is really stellar. And so I will give an introduction to Dr. Bao, who is with us right now. So Ting Bao is an integrative medicine specialist and the director of integrative breast oncology at Memorial Sloan Kettering. She received her medical degree from Johns Hopkins School of Medicine, a diploma at American Board of Medical Acupuncture from the Helm Medical Institute in California, completed her residency at Johns Hopkins Bayview Medical Center, completed a fellowship at Johns Hopkins Sidney Kimball Comprehensive Care Center, and is board certified in medical oncology and internal medicine. So Dr. Bao is a breast medical oncologist who takes an integrative medicine approach to cancer care. She's well published, writing review and opinion articles. She reviews manuscripts for professional journals, and so importantly, is here to share key insights with all of us today. So welcome, Dr. Bao.
Thank you so much. Thank you so much, Eileen. It's really my pleasure to be here. So let me share my screen. Can you see it? Okay, hearing none, assume you see it. Okay, great. So it's truly my pleasure to be here and talk about integrative medicine for breast cancer patients. So I'm a breast medical oncologist, diplomat of American Board of Medical Acupuncture, and also has Master of Science in Clinical Research. I'm at Memorial Sloan Kettering Cancer Center, a joint faculty at Integrative Medicine Service and Breast Medicine Service. So this is my background. So as Eileen mentioned, I was actually trained at Hopkins, and then I got my training in acupuncture at Helm Medical Institute, at that time affiliated with UCLA. I think now it's affiliated with Stanford. And then also I came to Memorial Sloan Kettering Cancer Center about almost 8 years ago. So here I got trained to be integrative medicine physician. So I'm also a physician scientist conducting integrative oncology clinical trials. So far I have completed and published 2 pilot studies. And right now I have 2 active ongoing multi-million-dollar NCI funded phase 3 randomized control trial. One is on acupuncture for chemotherapy-induced peripheral neuropathy treatment trial. Another one is on yoga for CIPN trial. So my long-term career goal is really to integrate complementary medicine into oncology practice to improve each patient's quality of life and overall survival. So today, I'm really happy to be here and then talk about the difference, first talk about difference between integrative medicine versus alternative medicine, because it took us like the past 30 years to really try to make the distinction between these two. And then also then after that, we'll talk about integrative medicine therapies include mind-body therapy, massage, acupuncture, diet, exercise, and dietary supplements. Then we'll have a brief summary, and then in the end, we'll open up to Q&A. So, integrative medicine versus alternative medicine. Initially, these two terms seems to be interchangeable, but then gradually people start really separating them. So at this point, we're really focusing on saying we're doing the integrative medicine part, which is usually non-invasive, evidence-based, and relatively inexpensive. The keyword is evidence-based. And also the other keyword is we use it alongside the conventional treatment, not in place of. And then also at this point, we're focusing on side effects and pain management. And whereas alternative medicine, usually the keyword is basically they are being promoted for use instead of conventional treatment. And often they're touted as sort of curative and can be expensive. And sometimes they come out with no evidence. The reason why I'm trying to distinguish this two is because there's more and more publication basically showing especially for breast cancer patients, if they're doing alternative medicine alone, their risk of death is 2 times. So that's why we're really trying to say we're trying to do the evidence-based integrative medicine. And then moving on, so the type of integrative medicine therapy, there are a few different categories. You can divide them as you want, but often we usually say it's like mind-body therapy, massage therapy, music therapy, acupuncture, diet, nutrition supplements, and exercise. I'll say in my clinic, so every Tuesday I have this integrative medicine clinic. And then we usually talk about diet, exercise, mind-body approach, massage, acupuncture, and dietary supplements. And then also has a specific area we talk about sleep, just because the majority of the patients are having trouble sleeping. So when we talk about complementary integrative medicine therapy, we usually try to divide them into 4 groups. A is safe and helpful, so no brainer, everyone should be doing that. And then B is safe. We're not quite sure if it's helpful, so more study needs to be done. But in general, it should be okay to go for it because it's safe. And C is useful, but with risk. And then we really have to discuss about the risk and benefit and then decide. And D is harmful, no benefit. And then in that case, it's no brainer as well. We shouldn't use it. And then for A, everyone should be using it. It's actually mind-body medicine therapy, such as this long list, meditation, hypnosis, if you can, especially the meditation, and guided imagery, biofeedback, breathing exercise, progressive muscle relaxation, yoga, and qigong. And actually the yoga and qigong, I think more study needs to be done in this area. And MBSR, mindful-based stress reduction. And then in terms of, we're still trying to study is, we know it's pretty safe, is massage. And then more and more study are being done to see how helpful it is. And if the effect is just short-term or it also has long-term effect. And then talking about massage therapy, so there has been a number of trials, but right now, lots of time focus on sort of just showing is like transient benefit. But our center right now actually has an ongoing, although it's almost finished enrolling, massage therapy compared with acupuncture treatment to reduce pain in patients with metastatic advanced cancer and with cancer-related pain. And then we're trying to see if, after the acute phase, will the effect last? So we'll see, hopefully in a year or 2, we'll be able to present the result. And then, so short-term data basically shows it seems to help reduce chemo-induced nausea, vomiting, reduce pain and inflammation, and also idea is help improve circulation and improve mood, and induce some comforting sensation. And specifically for breast cancer patients, it seems to be pretty helpful for axillary web syndrome, which is like porting after the breast surgery. But more study needs to be done in this area, and some mild lymphedema, and also post-mastectomy pain syndrome, and some kind of cancer pain. And then in terms of acupuncture, so that's also being studied right now. And so for those of you who don't know what acupuncture is, basically it involves using hair thin needle put in specific point in the body and manipulate it to reach therapeutic effect. This is, one of the most common acupuncture point we use is called LI4, large intestine 4. It's good for headache, any kind of pain, and sometimes good for energy. And then, so this is the needle. It's usually hair thin. And then the idea, it's a technique started in China about 3,000 years ago. The idea is you have this energy channel, about 14 major meridians, energy channel in the body. And if you have pain, say like along the energy meridian, say here, and then you don't have to put needle here, rather you can put needle along here. And then just to help the energy flow better and therefore decrease pain. That's a TCM, traditional Chinese medicine explanation of sort of mechanism of acupuncture. In terms of Western medicine sort of explanation of mechanism of acupuncture is that there's few mechanism, and so one is basically you insert the needle, stimulate the needle, then you reach this deqi sensation, some kind of pain, soreness. And then that stimulates the nerve, and then that sends signal to the brain, and then the brain can secrete those neurohormones, for example, such as like endorphin, beta endorphin. Then that elevates the pain threshold and actually make people feel pretty happy. It's kind of similar to exercise. Afterwards, they have certain feeling of euphoria. Some patients, not all, and then to reach therapeutic effect. So like I mentioned, and then another one is supposed to, the MRI study shows it may, by stimulate certain acupuncture point, they can activate specific area in the brain and to reach therapeutic effect. So in terms of the evidence, there has been so much study on acupuncture at this point. And then basically we gathered the strong evidence is really acupuncture is really good to reduce pain. And there's some strong evidence in supporting acupuncture to reduce chemotherapy-induced nausea and vomiting. And then there's some moderate evidence regarding using acupuncture to reduce hot flashes, dry mouth in head and neck cancer patients that is posed after radiation, and then GI immobility and insomnia. And then there's some modest evidence showing acupuncture can help decrease anxiety, fatigue, and depression. And in general, we do have some quite strong evidence showing that acupuncture is pretty safe, especially practiced in the hands of trained acupuncturists. And then specifically for breast cancer patients, so mainly we use in clinic often is to use acupuncture to reduce side effects of aromatase inhibitor. Chemo-induced peripheral neuropathy, that's what I'm studying. There's some evidence there, and reduce chemo-induced nausea, fatigue, and hot flashes. In terms of lymphedema, our center actually did a number of trials, and the most recent one is a randomized control trial. And unfortunately, it actually didn't show that acupuncture was better than no acupuncture, usual care in reducing lymphedema. So at this point, we don't necessarily recommend using acupuncture to treat lymphedema. And then specifically for acupuncture to reduce aromatase inhibitor-induced joint muscle pain. So there's this JAMA article basically showing that acupuncture basically is twice per week for 6 weeks, followed by once per week for 6 weeks, and followed by observation for 12 weeks. And by doing that, at the end of 6 weeks, there's 58% reduction in aromatase inhibitor-induced joint muscle pain in the real acupuncture arm, versus 33% in the sham acupuncture arm, versus like 31% in no acupuncture arm. This has been published in JAMA, which is one of the highest respected medical journal. And then, so that we use it often in clinic. And then in addition, for some patients who are scared of needles, we offer acupressure to treat common symptoms such as stress, anxiety, agitation. And then we use it alongside with meditation. And then also like, sometimes use with like self-hypnosis. So if you want, you can try. So there is this point, it's called Yin Tang point. It's center point between eyebrows. As if you feel anxious, sometimes you can just put pressure here, and then that can help decrease anxiety. And then another one is actually this one. It's this called Heart 7. So it's basically like it's sort of right. This is a wrist crease, and it's right offside the center at the edge here. And then by pressing here is actually really help with the mood and also help with sleep. So you can try that. And then I would say majority of my consultation often is on diet and dietary supplements. So diet is really important because in a way you are what you eat. So all major cancer organizations recommend activity, like exercise, and also healthy diet. And then mainly because it's associated with like better survival and just in general, everything's better. So we would say like the diet linked with increased risk of cancer is red meat, if you eat it greater than 2 times per week, and processed meat, and alcoholic drink, if you drink too much, say like in general, we recommend no more than twice per week. And then also food containing too much sugar, especially those refined sugar. And then the diet that is good is actually, those that is not non-starchy vegetables and some fruit. Usually we recommend berries, and then food containing dietary fiber and vitamin D. And then, so as a result, this is a recommended diet, is diverse and balanced diet, and emphasize on plant-based food for good source. And then usually we recommend 3 to 5 servings of non-starchy vegetables per day. So each serving is fist size. And then 2 to 4 servings of non-sweet fruits. So usually all the berries are non-sweet fruits. And then 1 apple has 19 grams of sugar in it. So you can still eat apple, but just be mindful. And then 1 banana has 11 grams of sugar in it. You can still eat it, but just know that in general, we say the whole day limited to 50 grams of sugar between diet and like additive, like things with additive sugar. And also some plant-based protein and plus some animal proteins to keep balance. And then, so in terms of restricted diet, we usually recommend limit red meat, as I mentioned, limit alcohol intake, especially for breast cancer, just because there has been like studies suggesting the more alcohol intake you take, the higher risk of breast cancer. And also avoid processed meat and eliminate as much as possible, say, white sugar, high fructose corn syrup, and artificial sweeteners. And then obesity. So it's very important cancer risk factor, and it's linked to postmenopausal breast cancer, and also linked to other cancers such as esophagus cancer, pancreas cancer, colorectal cancer, endometrial cancer, and kidney cancer. As you can see, this unfortunately is what we're facing. The obesity rate is increasing significantly over the years. And this is a consequence of obesity. It's basically bad for everything, like heart, sugar, increased cancer, worsening blood pressure, and lipid, and increased risk of stroke, and put heavy load on liver and gallbladder, and cause sleep apnea and respiratory problems, and cause like osteoarthritis and GYN problems. So that's our enemy. As a result, so for obesity, one is diet and another to help reduce it. One is diet and another is exercise. So as you can see, 25% of cancer cases worldwide are related to sedentary lifestyle and obesity. And exercise is a major focus of our research and major recommendation actually. All exercise is good. So for people who are not moving around, just by getting up just every hour to move around, make a difference. So it's never, there's nothing as too late to start or anything. It helps everyone and they can start anytime. And then also, yeah, sitting, I forgot which person said that, but they're saying like sitting is like the new smoking. So try not to sit for too long, get up regularly, just, yeah, move around, that helps. And the ultimate fitness goal is basically at least 30 minutes of sustained moderate intensity exercise, greater or equal to 6 days per week. So moderate basically means you can sweat a little, but not profusely. And you're a little bit out of breath, but not completely. And then one example of moderate exercise is actually fast walking is a very good exercise, moderate exercise. And then this is what exercise is doing. It helps increase muscle mass and cardiovascular fitness and increase your maximum walk distance and improve your immune system and improve your physical function and flexibility and quality of life and hemoglobin. And then it decrease body fat, decrease fatigue, decrease hospitalization time, and decrease blood pressure, and decrease stress and depression and anxiety. So everyone, honestly, should be exercising. And then this is a mechanism. So it's basically does wonder, decrease inflammation, even decrease sex hormone, which we know can increase risk of breast cancer and prevent obesity, decrease insulin, and all this. And exercise help increase breast cancer survival. And this study basically is significantly decreased the risk of death from breast cancer. And then I think this is the last one, mainly the dietary supplements. That actually is a major topic during my clinic when I see patients for integrative medicine. Because I think for no clear reason, I actually think there's a lot more data in like exercise and diet compared to dietary supplements. But some patients, often they focus so much on dietary supplements. And then this is one example. One patient will come in with all these things, dietary supplements, and then this is just, this consider less. I have a patient coming with a whole suitcase of dietary supplements. And just like, it's at this point, we really don't have the data, strong data saying it's really recommended for cancer prevention. It's used, it's definitely used, and study showed that 48% patients use multivitamin, 20% take vitamin C, D, and so all these different kind of dietary supplements. And I think this study didn't really quite try to figure out how, like how many, what percentage of patients using herbal supplements. So it will be interesting to see. And main question is, does it really help to prevent cancer? The short answer is benefit is still unclear. There's some conflicting data, and we really need to be cautious. So the reason why I'm saying that is people were very enthusiastic about this. That's why NIH actually funded a large cancer prevention trial called SELECT trial with millions of dollars and for a long time. And at that time, the idea is maybe selenium and vitamin E can help reduce cancer. So they actually did this SELECT trial with thousands of patients with high risk of having prostate cancer, and then randomized them into 4 groups actually. One group get both vitamin E and selenium. One group got vitamin E alone, one group got selenium alone, and one group got nothing. Then they follow them and compare. At the beginning, there's no big difference. I think it's 5-year follow-up. And then at 7-year follow-up, unfortunately, a significant increase in prostate cancer risk with vitamin E and selenium. So be very careful. And then the vitamin D, at this point, the data seems to suggest it does help reduce risk. And then the prostate cancer, again, so it's actually a U curve. So basically, when the level is between 20 and 40, it's actually decreased risk of prostate cancer. When it's less than 20 or over 40, it's increased the risk of cancer. And then for colorectal cancer, it's different. So the higher the vitamin D, the lower the risk is. So it's also showcased that every cancer is different as well. For other cancer, we don't have evidence showing it helps. So for this, we actually have this About Herbs website. For those of you who don't know, this is a great resource. We have over 280 monographs on different kind of dietary supplements. We have clinical summary, and then I usually go to, there's a summary basically how, like what to watch for. So that's the one I usually go to. And they have one part for patient, and it's a little shorter, and another part for like a physician. And then you can go more into details of mechanism. And then also we talk about drug-herb interaction and dosage, and then literary summary. Yeah, that's the one I usually go to right away. And then, yeah, so basically be careful in a way, just because lots of things they say, they help certain ways, but you may need to really to find out if it's like really evidence-based, is it really well supported or not. And then also the purity of the products is important. And another thing to consider, especially in breast cancer patients, is actually phytoestrogen, because lots of dietary supplements actually contains a lot of phytoestrogen. This is a list. So in patients with ER-positive breast cancer, try to avoid it. And then there's, in terms of soy products, bottom line is dosage does matter. And then there's certain thing, it's okay. Because honestly, if you try to avoid soy at all, you won't be able to like eat anything. It's basically in everything a little. So we would recommend, usually try to just limit it to less than 3 to 4 servings per week, because there's still controversial about, soy product, especially whole soy product, whether it's stimulating alpha estrogen receptor, which is bad, or beta estrogen receptor, which is actually good for the heart. So the jury is, I don't think it's possible we never will get the definitive answer, but still, I think at this point, there's enough data to suggest like the whole soy, whole soy products, a little bit is okay, moderation is okay, and not too much. And then another thing to be concerned about is herb-drug interaction, because some strong antioxidant can interfere with treatment, such as radiation and some chemo, and some can increase the risk of bleeding. And then we talk about phytoestrogen can counteract the anti-estrogen therapy. And then some other indirect interaction is they may interact with the liver enzyme, and then we may change your, say, tamoxifen drug concentration, and which is an anti-breast cancer treatment. And dosage does matter. So as you can see, if all these 20 different supplements in total is 20 milligram, the chances of it make a big difference is very, very small. So it should probably be okay. Yeah. So in summary, so leading cancer center are really incorporating integrated medicine in cancer care delivery. And then patients and clinicians should be aware of integrated medicine therapies available. And a number of integrated medicine therapies can be recommended to cancer patients, but further studies are definitely needed. So those are the sort of sources for future information. And I'm happy to take any questions at this point.
Okay, Dr. Bao, it's Eileen. So I do have a few questions. I've been monitoring the chat, but probably one of the first ones is that you briefly put up the website for the herbal supplement of information. Can you repeat that? Because I didn't write it down, and then I don't have it, and several people are asking for it.
Of course. Oh. Is this one? This is MSK about herbs.
That's it. That's it.
So mskcc.org// about herbs. Yeah. Okay.
All right, we'll start there. But there are some other questions, and so we'll reiterate that maybe Chris, you could put that into the chat if you don't mind. I know you're there, so, or Jamila. So a few questions that came in. This was one of the early ones. How often do you recommend acupuncture treatments for stress and anxiety? Once a month, twice a month? Is there a way to judge that?
I think just because the data for this one is not the strongest. And for other conditions, we usually use twice per week for 2 weeks, and then weekly for a few weeks. But that's primarily for pain. And then we just basically do a sort of maintenance treatment like once a month. So I think it depends on the person. If you only use it for anxiety, I mean, basically start with, I would say, maybe once a week for 2 weeks, and then space it out as you think fit. Yeah, just because everyone's different. And then I have a patient, I've been working with her for a while. I use acupuncture to help her with hot flashes. And then, so basically she would know. She would just say, this is every 5 weeks is too long because my hot flash come back. So every 4 weeks is just right. So we started with more intense one, and then now we reach to once a month, and then everyone's happy. So I think, yeah, that's my recommendation. Yeah.
Okay, great. I think that makes a lot of sense. This is another question about acupuncture. Is it okay to have an acupuncture treatment on the same side, on the arm that the breast was surgically removed, or
right. Yeah, definitely. That's a great question. Yeah, so I think it's not just the breast, it's the lymph nodes that's people really concerned about.
Yes.
It depends on how many lymph nodes are removed. If you have, like, I would say greater than 15 lymph nodes removed, the risk of lymphedema is high. The risk of infection in that lymph is high. Our study on lymphedema, even though it didn't really show acupuncture help with lymphedema, in general, it shows it seems to be safe because we actually put needle in the arm with lymphedema, and only 1 out of 800 treatments has infection. But that's in the setting of, unfortunately, the patient was using dirty wrap to wrap around it after the treatment for many reasons. Then she had to go to urgent care and be started on antibiotics, and then it got better. So I would say no strong contraindication. However, if you don't feel comfortable having them put needle in there, just tell the acupuncturist, I don't feel comfortable putting needles there. And then they really respect that. Yeah.
You know, I'm gonna throw out another question in the middle of this, and this didn't come from the group, but as people are dealing with lymphedema, there is not always a lot of information and guidance as to help to keep people on the side of not developing more aggressive, you know, swelling and so forth. And so how can people kind of judge this for themselves, or, you know, this wasn't asked, but should they see a lymphedema therapist prior to acupuncture or something? I'm just going to throw this out because I think we all want to be very careful about this topic.
Right, I totally agree. I think when I look at the data, I think the manual compression and the sort of the maybe not massage, but then, you know, the compressing seems to be effective, done by lymphedema expert. So I do think it makes sense for the patients with lymphedema to see a lymphedema like clinic, to be seen in lymphedema clinic. And then they can also like help the patient to gauge. They have different kind of measurement and then lots of education. And for now, our center, at least we didn't see the benefit of acupuncture, but I mean, it may be because the points we're choosing, or so I wouldn't just totally rule out that acupuncture may be helpful. I know Dana-Farber in Boston, they did a study. They said it seems to be helpful. I don't know if it's published yet, but anyway. So I just don't want to say just because our center didn't show as positive, then absolutely don't go to see acupuncturist for this. I think acupuncture can help so many other things, and but I wouldn't necessarily use acupuncture as a sole treatment to treat lymphedema.
Good. Okay. Thank you. I appreciate your clarification there. So now we're going to go over to the topic of nutrition for a couple questions. There are plant-based ingredients in the meat alternatives that should be avoided either during certain cancer treatments and whatnot, or following.
You mean, okay, sorry. Can you just
the meat alternative products, you know, as people are trying to incorporate other proteins into their diet. There, you know, there is absolutely more availability and options in some of these meat alternative products. And I think the questions are, all right, what's in these? I don't really understand all the ingredients, and how do we, and it may be, I think it's a tough question, quite honestly.
Right. That's why I was like, but yeah, mainly because I should probably do some research about this. I personally don't quite know which ingredients they use to make this meat alternative. I know like when I go to Thai restaurant, they do the mock duck, and that's made of tofu, and they put lots of sugar in it. So that may not be the best, alternative. But I just personally, it's a meat alternative. I would imagine they use lots of like soy products. So if you have like ER positive breast cancer, maybe it's not a good thing to do. So I would say I would imagine not all the meat alternative are the same either. So I would say maybe just find out exactly what kind of ingredients they have, and if they have lots of soy products, maybe just avoid it. Or moderation.
Okay, then I think that's a topic to be continued. I think it's probably a good one for some future.
I think so. Some people who have really done some research in this alternative meat part, and educate.
Good deal, but it's a good question. So let's move on to a few other things here. You had a slide that showed the survival. Can you show the survival rate slide that was a result of exercise and diet? Please showing to be fit in survival. I think that question, I'm not completely understanding it, but I think she wanted to see that slide one more time, if you don't mind. There we go.
Well, this is one. It's just like the lifestyle change will change it. And then another one, let me see. And this is one, exercise. Is increased
Okay.
survival. So 50 to 60% decrease in adjusted risk of death from breast cancer.
Okay. So
Yeah.
Karen, I hope that answers your question. If you've got something else, just let us, just put it in the chat. I'm going to continue on down. Have you looked at training for licensed massage therapists to become certified in oncology massage?
Training. I think MSK has, we have 11 massage therapists, and they're all doing oncology massage. In terms of training program, I think they're thinking about starting one. So that's a great question. So I'll talk to them. I'll talk to the lead massage therapist and maybe just say, now today I heard someone are interested. It sounds like the interest in community is high, so we should probably push this forward. We were really working on this, and then COVID hit, and then everything is on hold. We had to close our center for like a good few months. Yeah.
Are there vitamins you can suggest so people are not overdosing on vitamins in addition to a good diet and exercise?
Yeah, so in a way, I feel like we should be able to get enough nutrition, most vitamins from if you're doing eating a balanced meal from Whole Foods. And then the only vitamins we cannot really do it just through the food, get enough from food, is vitamin D. So I think everyone should probably check their vitamin D level at least once a year. And then if it's low, and just supplements with vitamin D. In fact, almost everyone who I talk to, if they're not taking vitamin D supplements, their vitamin D is low. So in general, we usually recommend 2,000 international units once per day. And then take it with food or after food because it's fat soluble. Don't take it empty stomach, especially in the morning. And then you can check the level and then adjust it and then just stay on. Yeah, that's the one I usually recommend to almost everyone. Yeah. And then just remember that during COVID, there's lots of talk about vitamin D can prevent COVID. So some patients were taking it a lot, like 5,000, 10,000. And then we have a few cases of patient coming in with severely high vitamin D. And then one of the symptoms of possibly high vitamin D is palpitation. So my patient's vitamin D level wasn't like super high, was in the 70s, and then she started having palpitation. Then she went to emergency room. And yeah, but I don't know if it's fully correlated, but I do have some other patients reported palpitation on high dose vitamin D. So just to once again to say, too much may not be good either. So just be careful.
So before we move on to the next question, because it goes away from the vitamin D topic, but there was a quick question about, and I'm going to go down here and I'm just trying to find it. Okay. So someone asked about if there's a difference in terms of the need for vitamin D in our system of being a person who's dealing with it and who's in breast cancer diagnosis versus someone who isn't. Like, do you need more vitamin D if you're in treatment? I think that's the question. I think if I'm understanding that right, please clarify.
That's a very interesting question. I don't think people have looked into that. What I can say is, I think lots of breast cancer patients, there's one study many years ago saying at diagnosis, they just randomly checked patients' vitamin D level, and then 98% were low in vitamin D. So I think I would rather just basically provide vitamin D supplements based on their level rather than their treatment, whether they're in treatment or not. Yeah.
So so in terms of checking the level of vitamin D levels, that's only able to be done through a blood test, correct? A lab test?
Yeah. Yeah.
Okay.
It's a blood test.
That would be part of yearly lab work that someone would get done and speak about with their physician.
Yeah, I think a primary care doctor started doing that, I think a few years ago. And then now this is part of the annual check. Usually people check vitamin D level. And surprise, surprise, most people are low. Yeah.
Going back to the acupuncture question, we were going back on on lymphedema. But in general, is there, so this is I'll read the question. Should acupuncture be recommended for all cancer patients, or in what cases would acupuncture not be suitable?
People allergic to metal, definitely not. And people have needle phobia. Yeah, it's because you want to create some kind of sort of a good sensation rather than like just painful, just upset, and yeah, then that's not a good treatment. We actually have some patients doing that. Like one of the actually expert in exercise, very fit person, and then she was doing acupuncture research. Then she got testing sort of sample acupuncture treatment. She said it hurts the whole time and she hated every minute. So I think for people like that, no need to repeat that, because it's supposed to make you feel better and not worse. Yeah. And then in general, I think other than that, I mean, acupuncture is really good for symptoms control. If you have zero symptom, I don't think you need to do acupuncture. It's hard to improve. Yeah.
I have two questions here, and I think these are pretty big questions, and perhaps there's a way to kind of frame an answer. Are there alternative therapies? At the beginning of your talk today, you were articulating the alternative versus integrative concepts. So in the world of alternative therapy, are there ones that perhaps our patients should consider? Or is there any guide in that along those lines? And do you feel like you can speak to that?
Yeah, that's a great question. And I don't feel I'm qualified to speak to that just because this is like, I don't, that's not where I, do research. I really read up upon a lot. But on the other hand, I come across certain studies in the setting, for example, patients with end-stage pancreatic cancer has no other treatment options. And then Mayo Clinic actually did a study on high-dose curcumin, 8 grams. And then I think on 21 patients or 23 patients, and then some patients, 3 had stable disease. So that kind of thing. So I came across that. So I think in certain setting, I think it's reasonable. But I think it got to be a sort of agreement with the primary treatment team rather than just like the treatment, the primary team recommends certain thing, you completely just like refuse that and then go the other route. I have worked with a few patients doing that, and unfortunately the outcome is just disastrous. So I wouldn't recommend that. But on the other hand, I don't claim I'm the expert in alternative medicine. So yeah.
After each one of our sessions, I have put out an evaluation piece, and the number of topics have come back around. And I think the topic of alternative medicines would probably merit its own talk.
Yeah, I agree.
I think it would be, and I would say that to everybody who's, listening and participating today, is that will go on our parking lot list for our next upcoming series, which will take place in the fall. We'll start again or address some of it sooner, but I think it merits much more discussion and find some people who have gotten a little bit more in the weeds of that topic, which is, I think, a big one. And there are certainly compelling stories that you hear from people that have explored certain therapies that have truly had therapeutic benefit for them. And so we don't want to dismiss the concept. Go on.
Yeah, that's wonderful. Let me know when that happens. I would like to listen to that. And then
I think a lot of people want to listen to that.
Yes, because I think we should keep open mind. I mean, just because we don't know doesn't mean it's not there. So, and then I do want to add, it's kind of depends on the cancer. So this article basically saying, there's one article basically saying for breast cancer, definitely using alternative medicine, like double the risk of death. But then, so one specific group, prostate cancer patients. So if they have sort of biochemical disease recurrence with no other symptoms, and then whether to do surgery radiation versus do dietary supplements. And then the dietary supplement part seems to kind of hold the disease for similar time for a while. So that's a specific population group that may be okay. But with that being said, even the prostate medical oncologists are aware of that, so they're open to it. What I'm trying to discourage is basically hide certain things from one group and then do your own thing. But I really encourage open discussion. I think it's time for people to hear both sides. Yeah.
Thank you. I would agree with you completely on that. Going back to lymphedema, and again, this may fall out. Are there nutritional options to diminish the risks of developing lymphedema, especially if you've had more than 15 lymph nodes removed with your breast cancer surgery?
Yeah, that's a great question. I unfortunately am not the expert in that, so I cannot comment on that. I would recommend maybe you guys, sounds like lots of people are interested in lymphedema, so maybe have another talk on lymphedema and get some expert on this and talk about different areas to help with lymphedema. Yeah.
Okay, I'm going to move on because there's a bunch more questions and I know we'll have a stop shortly. So would alcohol consumption in moderation, such as in the Mediterranean diet, have health benefits during cancer treatment?
So you're saying, right, Mediterranean. So that's an interesting question. So we usually said it's okay to drink like twice per week, but just because some other epidemiologic studies suggest more than that, it seems to really increase the risk of cancer. So I think, twice per week should probably be okay. But then once again, the red wine, so they had this resveratrol, and then that has phytoestrogen in it. So that may potentially interfere as well. So just, I think once in doubt, moderation.
There's another question on lymphedema related to exercise. I'm going to skip that one too. And so we will, and I agree with you that we need to address the topic of lymphedema coming up again. We may do a special on that. So I do have a comment. You had talked about the MSK starting a program for oncology massage. And so
we're thinking about it. Yeah. So hopefully soon. Yeah. But as you know, this whole COVID thing, we actually doesn't allow observer for the longest time. I don't even know when we restart. We were thinking about starting some kind of a residency, oncology massage residency program. Let me follow up, see where things are at this point.
Okay, and so, but I believe there are some other programs that are out there, and this is one of the comments that was coming in.
Yeah. Oh, great. Yeah.
I think we've addressed the question of the need for the amounts of vitamin D and the suggestion that people get their vitamin D level checked and then consider dosage in conjunction with your physician. And so do you have any thoughts or consumer information on recommending frozen vegetables versus fresh?
Personally, I still think fresh is better if that can be done. And if not, then maybe frozen is fine. It's better than nothing.
Okay. We did a talk in December on nutrition. And so you have an audience, and many of the people who are on today were on as part of our program or listened to the program afterwards in December. So there's a lot of education out there, and certainly there's a whole lot of interest. And I think as I listen to the questions and in your talk and presentation, we're all getting more educated and knowledgeable in the area of, how do we feed our bodies and nourish our bodies to help fend off, potential disease states and to build our immune system. So I think there's a whole host of that. Two Life is putting out more of that information in a very general format, but a lot of the information we're putting out is the appropriate links to other particularly medical institutions that are, putting a lot of very useful functional information out there to help us make more informed decisions and still consider eating as, fun and entertaining and, just I think is so good for us in so many ways, sharing that diet. Okay, so I am, and again, another piece on the medical oncologist. Okay, and so there's a question about, will we have the slides in addition to the recording? And I think you had a problem with sending the slides.
Yeah,
and
because
so
my slide is too big. And our institution has a limit in how big a file we can send out. So that's a problem. Yeah, so you know what? Yeah, unfortunately, sorry. Yeah. If you need certain, like, I don't know. Well, yeah. What do you propose? I mean, yeah.
So you know what, there were a couple of slides that I think had some very functional, useful information, particularly on some of your links. If we could get either a, sort of a PDF of a couple of those, I think could be helpful as handouts, which we could make available. But then each one of your slides, naturally, you spoke to the content of the information. So when people look at the recording again, and we will make a recording available, sometimes it takes us a day or two to get the, there's some editing that needs to be done. And so we have to kind of work within those technical guidelines. And certainly, no, I don't have the ability to do that. I don't have that. So let's continue on. Have any complementary medicine modalities been shown to help control triple-negative breast cancer specifically?
So to treat cancer, not yet. I mean, we're actually looking into it. Just because I think triple-negative cancer tend to respond to immunotherapy. So we are actually looking into the natural things can boost immune system, such as the medicinal mushroom. So we were going to do a clinical trial on this, but then the immunotherapy really took off in triple negative, and then we kind of have a difficulty getting funding. But if you know someone, feel free to send it my way, are interested in supporting us doing medicinal mushroom to treat, sort of not treat, but at least prevent triple negative cancer from recurring, please connect with me. Because this is some trial I was going to do in a few years, but then just funding just fall apart. Yeah.
So you're inviting people to participate in your clinical trial? I'm just getting my head around. Okay.
For this one, for the mushroom. Yeah. So yeah, certainly, yeah. So yeah, we do have two clinical trial on chemotherapy-induced peripheral neuropathy. So people with painful peripheral neuropathy, chemo-induced peripheral neuropathy, and let me know, because we have either acupuncture or yoga intervention to offer. And yeah, it's going to be compare real acupuncture with sham acupuncture, and yoga with education versus no yoga, to really sort of try to establish the efficacy of each intervention. Yeah, thank you.
Okay, good deal. So let's see. The next question, do you recommend taking probiotics in addition to healthy diet and strengthen to get the microbiome as a preventative measure?
I think it's a great idea. Yeah. So for probiotics, yeah, it just be careful during active cancer treatment, because sometimes cancer treatment lower the cell count, this white cell count nadir, and then the probiotic is supposed to be live bacteria. So in that setting, it's a little bit tricky. So I would say maybe hold off during that time. Usually it's nadir at day 8 to 12 after the intense chemo, Adriamycin plus Cytoxan. Yeah.
Dr. Bao, thank you very much. I'll do a wrap up with the group. We appreciate your time. I will write to you about a couple of slides if we can get that information out. And obviously you had some lively conversations, so you sparked a lot of inquiry today. So we thank you for your time.
Oh, you're welcome. And thank you everyone for your interest. Yeah, I had a great time. Thank you.
I know. And I so appreciate you kind of responding and interacting with us. And interacting with Dr. Bao, I think she had a lot of information, but I took away several things here. And so one of the things that Chris did was put the MSK herb page link up in your chat. So if you grab that, but I'll also put it into the email that I sent out with the invite and all the people who registered for today. We had a pretty good, I think, a wonderful turnout, but I will get the information back out as well as the evaluation. That'll all go out today. There will be a link to the presentation that you'll be able to see again and have access to all of the slide information in the presentation. And that will go out and probably be a day or two before I get that live and going. But two things I wanted to mention. One is that in the feedback I got from previous sessions and some other survivor talk and support groups is that Two Life has launched a yoga program. And I know Jamila is on the call with us today. And so we are really delighted to offer a gentle yoga program with two really wonderful instructors, a woman by the name of Cheryl Campbell, who runs and owns the Baptiste Power Yoga, along with Allie Jacks. And you might recognize Allie Jacks' name because she has been the Siena women's basketball coach for a number of years. And so they have started a program. The next class is next Tuesday night from 7 to 8. Jamila is taking care of getting all the people registered. Jamila's email is jhills, Hills, at twolife.org, or call the office if that is more convenient for you, and we'll get the email. It's a virtual class, and so you will have, you'll be sent a link so that you can participate from the comfort of your home. This concludes our Women's Health Conference series for the 21-22 season. It doesn't mean that we don't educate anymore. And I clearly saw there was a couple things that came out in this talk that we will put forth and either do another, either a Zoom program or do something via Facebook Live. We've done a couple of those things, and see if we can get some information out, perhaps a few blog articles, and we might do some research and get information available, because clearly people are looking for that information. Okay, so with that, I think we are going to close up. I want to say thank you to, you see Jamila. The person you don't see is Chris, who is the genius behind keeping our Zoom program alive and going. And I thank you, Chris, and the rest of the staff at Two Life for all your work in getting the programs promoted. We had a good, I think we had a great audience today. I think we had 127 people registered. And so again, I'll reiterate that we'll make available the recording, and then a lot of people were viewing that recording, and you can send that link out to other people that you can think of that were not available for today. I welcome you to do that. And the more people that we can share this information, certainly the ability to bring in experts in their field has been really the silver lining of doing these programs virtually. And I think everyone will agree that we addressed topics related to reoccurrence and nutrition, and today with integrative medicine that were really, that really sparked the attention and give us some great information to go forward with. So with that, I will say have a wonderful, wonderful day. Thank you for being part of today's program, and look for a couple of emails to come through. All right, thank you. Bye now.